Hi guys, my name is Jacqueline or Jackie Powers, and today I'm going to do a presentation over nursing burnout and increasing problem. Those of you who've read some of my discussion posts might know that I'm actually a nursing student at another school, and so this topic kind of hits home for me, I guess, because I've been around a lot of nurses and I've kind of seen this firsthand in the field, and so it really piqued my curiosity. So that's why I decided to research it. You'll have to excuse me. I've been kind of sick with like some allergies or something. And so if I sneeze or get a drink throughout the presentation, please don't be surprised. So nursing shortages are happening all over the nation. One cause leading to this problem is nursing burnout. So in this presentation, I'm going to examine nursing burnout, the factors that contribute to it, the effect it has on patients and the facilities, and some potential solutions. So nurses are one of the fastest growing careers. I'm sure most of us know somebody that is a nurse or somebody that's going to school to be a nurse. There's nursing schools all over the place. Nurses work in hospitals, clinics, pharmacies, schools, prisons, and many more different places. So it's clear that this is a issue that would affect a lot of people in a lot of different types of facilities. Nurses also experience some of the highest turnover rates. The RN Work Project reports that 33% of nurses leave the bedside within their first 2 years of work. It's a pretty substantial number, considering that most nurses go to school for a minimum of 2 years. And then, to do all that hard work and only make it 2 years on the floor, it really tells you that there's something going on there. This contributes to the current nursing shortage. Some of these nurses move on to different areas and others move on to different careers completely. So what is nursing burnout? Nursing burnout is also known as compassion fatigue. It's defined as physical, spiritual, and emotional depletion of those suffering from extreme stress and exhaustion at work after caring for the critically ill. Another definition is detachment from work and feelings of ineffectiveness on the job, leading to a downward spiral. So, as you can tell, kind of a serious sounding thing. It's a little bit more than just being overwhelmed. It contributes to employee turnover in the medical field, leading to nursing shortage. So you can kind of see here the cycle of nursing shortage. It starts out with job dissatisfaction, leads to burnout, leads to nursing turnover, which leads to a nursing shortage, inadequate staffing, which kind of turns the whole thing full circle. Then you have the same problems all over again. So it's really a never ending cycle. So why does it matter? Studies show that up to 40% of nurses are experiencing nursing burnout. It's a lot. That means half the nurses, almost half the nurses out there, are going through this. It affects their health and their job performance. Those suffering from nursing burnout are not as capable of providing high quality care. That's something that's been shown in actual studies. Nurses may not even realize they are suffering from burnout. One source actually says that it's easier to recognize burnout in someone else than it is yourself, which is kind of surprising. So, what causes nursing burnout? Workload stress is one of the major things. Nurses these days are expected to take a high patient load. Depending on the facility, nurses might take as many as 8 patients per shift. Um, Understaffing, like I said, there's a nursing shortage, so there's often not enough nurses there to cover, and people are having to step in, they're having to work overtime, they're having to stay late, which kind of leads into the long hours. A standard shift is usually 12 hours for a nurse, and so that's a long shift. You're exhausted, and then sometimes having to work extra or having to work an extra day during the week can really lead to exhaustion very quickly. The work environment is another thing that leads to nursing burnout. Nurses are often working around critical patients. They're exposed to pain, suffering, death, all kinds of things that most of us are naive to. Some studies have shown that nurses who work in certain fields like pediatrics or oncology, those who have cancer, that they experience more or higher incidence of nursing burnout just due to the nature of the fields themselves and what they're exposed to. Work relationships are another thing that cause nursing burnout. Nurses are known to eat their young, which basically is just older nurses are not as kind to younger nurses. I guess they find them frustrating. They aren't as willing to help. A lot of them kind of forget where they came from, that they were in that position one day, and they can really be rough. There's also a lot of cliques in the nursing field. You know, all the shifts kind of have certain people that hang out, and the night shift always has problems with the day shift, and back and forth, and so there's a lot of conflict just on a personal level in most medical facilities. Poor communication with upper management is another issue. Well, there's my cat. Uh, Sometimes there's people that are in management positions that have never worked on the floor. There might be people that are younger than a lot of the nurses working on the field and don't have as much experience, and sometimes that's frustrating. Um, there's also a saying that management kind of forgets where they came from. Even if they have worked on the floor in the past, they forget what it's like to be a nurse, and they just have exceeding demands and expectations of them that a lot of nurses feel it's too hard to fulfill as part of their job duties, and that leads to a lot of frustration. So this is a really good project to look at from an interdisciplinary perspective. You have nurses that are taking care of patients, they're working in facilities. There's a lot of different things that are affected when you have almost 40% of nurses that are suffering from this burnout. So psychology is one of the fields you can use to look at this issue. Psychology can kind of help us understand why nurses get burned out and what are some of the ways that we can combat this. Organizational leadership is another position that we can use to look at this issue. We can look at internal conflicts that I mentioned earlier and upper management, how they're handling it, what they're expecting out of nurses, how they can improve communication between themselves and the nurses. Quality improvement is another way that we can look at this issue, how it affects nursing errors and patient satisfaction. From a financial standpoint, nursing burnout can really have a big impact on a facility. Between the cost of mistakes and the cost of replacing nurses, it's a really expensive issue to deal with. So, in the psychology aspect, some factors leading to nursing burnout are emotional attachment combined with poor outcomes. Patients obviously pull at the heartstrings of nurses, and it's kind of hard not to get attached from time to time, and you suffer with those patients and their families in a way. Increased incidence in those working in oncology or with sick children. Like I mentioned, you know, a lot of those fields are especially troublesome to work with those people and see what they're going through. And nurses usually tend to have a little bit higher incident of this when they work in those areas. Grief and suffering of patients becomes their own. There's not enough time to decompress between shifts. Many nurses work their shifts back to back, so they might have 3 12-hour days in a row, and that's just really exhausting, and they don't necessarily have enough time to recover in between their shifts. Some ways to improve burnout are participate in self-care or self-reflection, workplace programs to help employees deal with tragedy. And a lot of times they have counselors and stuff available to talk to. Self-care like exercise, diet, and hobbies outside of work. That's always good for anybody. And psychological empowerment through good working environment. It's really important. You'll see throughout this that the working environment has a pretty big role in nursing burnout. So organizational leadership. Studies show that nurse to patient ratios are directly related to nursing burnout. Like I said, nurses can take up to 8 patients. And obviously, the more patients they have, the higher their workload is. Usually, the more overwhelmed and stressed they are. And so, a lower patient to staff ratio can really improve this. There's some studies in California who have a mandated nurse to patient ratio, and those studies actually showed that in that state, where they have that mandated ratio, there was a decreased incidence of nursing burnout. Unaddressed workplace safety issues that are being handled incorrectly. It's pretty self-explanatory that everybody's entitled to a safe workplace. So when you're working somewhere and the safety issues are not being dealt with, that can definitely be a huge stressor. Nurses that are forced to take on more patients and work longer hours to meet demands and cut costs. Frustration due to lack of support. For example, one nurse was told to use her nursing judgment, but was later criticized for the decision she made. So it's kind of like you can't win for losing. And they're expected to perform large number of tasks with no errors. Very little room for errors in the medical field. And they can also result in grave injury or even death for patients. Quality improvement. Nurses suffering from burnout are more likely to make mistakes with medications, perform skills incorrectly, or ultimately harm the patient. It puts nurses' careers in jeopardy as there is a very small margin for error in the medical field. Kind of just said that. Studies have shown that higher nurse-to-patient ratios were directly related to an increased number of patient infections. That's interesting. That just means that when nurses had a higher patient load, their patients were more likely to get an infection in the hospital, which is important, as you'll see in finance, because infections that are acquired in the hospital are generally not billable to the patient. So that's all a cost that the hospital has to incur themselves. And they're usually pretty strict on that. They monitor that pretty closely. So that can mean trouble for the nurse if they're having a higher incidence of infection in their patients. Studies also show that patient satisfaction is higher in hospitals with adequate staff, good support, and proper working relationships. So for the financial impact, the average cost of replacing a nurse who decides to leave the bedside ranges from $10,000 to $88,000. An acute care hospital with about 600 beds can see an annual cost around $6 million spent just in replacing nurses alone. Hospitals that were able to reduce burnout by 30% had a total of 6,239 fewer infections for an annual savings of $68 million. Pretty big numbers there. So how can we fix nursing burnout? Better staffing ratios, communication with upper management, increase nursing autonomy, which just means give nurses a little bit more independence to make decisions. They've had a lot of training. They went to school. They know their patients, and a lot of times they're made to feel like their opinion doesn't matter. More time off for nurses, improve workplace relationships, and provide a safe workplace environment. And for the conclusion, nursing burnout is a real problem that affects a large amount of people every day. It's clear that it has a detrimental effect on the employee, the patients, and the facility they work for. Facilities need to take a hard look at what they could do to improve working conditions and decrease the incidence of nursing burnout within their organizations. The benefits will likely outweigh the cost as patient and employee satisfaction improves and mistakes and turnover are less likely to happen. Here's my references, and thanks for listening, guys.